Hello friends, today we'll be discussing a case or a type of case which is considered a nightmare for a hair transplant surgeon, because these are areas which have extensive baldness with less donor area and curly hair. So all the difficulties, extensive baldness, less donor and curly hair. So these are called the most difficult cases so far hair transplant is concerned. So these are the pre-op pictures, and if you see, it is clearly the extensive baldness which we call beyond grade 6. A big surface area of the scalp and a full baldness. And even the donor area, if you see, is wavy and curly. So these kind of donor areas are considered difficult when it comes to perfect eye. Another difficulty that the patient does not want the FUT procedure to be done. So all we had to manage was through the perfect eye technique, which is basically a modified FUE. So we had limitations. We had to cover a big area. We could not do FUT. We had to manage grafts in FUE procedure, and the hair were thin and slightly on the wavy curlier side. So what we planned, ideally we would want to put 10,000 grafts in such patients because it's a huge area to cover, which is not possible using only the FUE procedure in such kind of donor areas. So what we planned for him was around 5,800 grafts over 2 sessions using scalp and beard hair. Again, we could not use body hair because they were not a lot and they were very thin. So scalp and beard hair were used over 2 sessions, and this is what we achieved. So believe it or not, this is what we got. This is not a fad, this is a purely hair transplant result, but with certain tricks. So just with a hair transplant, a plain hair transplant, only hair transplant, will not give us this kind of result. So we'll talk in detail of what we did, how we did, and how come after 2 years this person is looking from here to here. Now, the first surgery, so as I told you, the surgery was done over 2 sessions. First procedure was for the front. We used roughly 4,000 grafts. We did around 3,500 grafts from the scalp and 500-600 grafts we took from the beard, and this is what we did. So we reached from here till here. This is 8 months after his first transplant. So nothing else has been done. Hair transplant and just a hair transplant, and this is how it looks after 8 months. It's better than bald, but not very neat because the hair is curly. We have a curly nature to the hair and it has grown curly, less combable. But this is how it is. A top view. We have managed a good top view, reasonable density. The area is getting covered, but it's not looking very neat. But what about the crown area? Side views looks okay because the front has been covered nicely, but the challenge is the crown area. So because we have already planned this procedure in over 2 sessions and gap was around 8 months, this picture is taken just before his second transplant. The front looks okay, but the crown is better than before. There are some hair, but scalp is totally visible because we have just put 500 or 600 grafts over his crown area. So a big crown which was totally bald, and of course medicines can't do anything here. We have done some coverage. We have put 5 because we got 500-600 extra grafts than what we planned. So we put those hair here. The front is nice, fluffy, well covered. But this area, some hair has been transplanted so that you don't have a full patch. So this area was covered in the second procedure where we did around 2,000 odd grafts using predominantly beard hair, some scalp hair, and covered this area also. Now we did around 2,000 grafts for him using predominantly beard hair, some scalp hair, and now we will showcase you how it looks 1 year after his second transplant and around 20 months after his first transplant. And mind you, this will not be just transplant, we use certain more things to make it look better, and we will discuss that now. Before transplant, after first surgery, and then 1 year after second surgery. Because though we want that even if we have extensive grade of baldness, even we have less donor area, after a transplant we should have hair everywhere. Even the side view becomes so much better because now it's looking so neat and so very well combed. Of course, we will see that why there is less density on the hairline, because again we have less donor. We have covered a 300 centimeter square of baldness with less than 6,000 grafts. So this is on an average, we see this is a density of 20. On the front it is 30 grafts per square centimeter, and then as we go back we have reduced it even further. So this is why, though we want a very dense hairline, but we could not give it, because we have less donor, but it is so much better than being bald. Of course, here, now baldness is not a disease. You don't need to treat baldness. Many people are so comfortable, they look so good, and they carry themselves so very well with their bald look that they don't need anything. However, if baldness concerns you, if it bothers you, then we have a solution for that. So that was it about this case, which I was very, very happy to share with. And again, I want to thank the patient that he agreed to share his story with us and with all of you, because this was something interesting, that even a person who has an extensive hair loss can be managed through a hair transplant with certain tricks, with certain illusions, and overall we get a much pleasing result without the need of any makeups or any concealers. So thank you very much. I hope you liked this case, and if you have any further comments, please feel free to ask us. Thank you.